Hello, welcome to a new tutorial presented by the SchrDbb. In this tutorial, we're going to see neonatal sepsis. Now, to see neonatal sepsis, you're still going to visualize the SchrDbb algorithm. So we start with the disease, range of the disease, differential diagnosis, endemic disease. You have the cause. You go down to the complication, then above you have the background, and then lastly you have the prognosis. This corresponds to the diagram, which is disease corresponds to mechanism, and then you have the cause. Among the cause you have the pathogenesis. Now among the complication you have the pathophysiology, and then outside you have the background, which is corresponding to the risk factors and the epidemiology, and then lastly we have the follow-up with the prognosis. So those are the different elements that you have to visualize. So now the first thing we're going to start with is what is the definition of neonatal sepsis. It is very important to know the definition of neonatal sepsis. Neonatal sepsis is just defined as we have infection, systemic infection in a neonate. That's the simple definition of neonatal sepsis. It is a systemic infection, or the bloodstream infection of the neonate, or blood infection of the neonate. So when you have a systemic infection of neonate, it's going to be called neonatal sepsis. Now, before we continue, I want us to define what is a neonate. Now, neonate is considered from the first day of life to 28 days after delivery or 1 month after delivery. Generally, that's how we consider neonate. Neonate is from the first day of life to 28 days after delivery. But now, sometimes certain doctors like extending the neonatal period by considering neonatal sepsis as children that are less than 3 months. So sometimes when children are less than 3 months, we still call it neonatal sepsis when children are less than 3 months. But actually the definition of neonate is actually for the first to the 28th day of life, or the first month of life. But now some doctors, like in our context, we extend neonatology period to 3 months. So that's why children that are neonates can be managed. Children who are the first 1 month can be managed in the same room like children that are 3 months in our context. So that is for neonatal sepsis. Now, before we continue, you need to know the classification of neonatal sepsis. The classification of neonatal sepsis. Now, how is it classified? The classification of neonatal sepsis is divided into two. You have the early onset neonatal sepsis, and you have the late onset neonatal sepsis. Now, for the early onset of neonatal sepsis occur less than 3 days. If you have a systemic infection less than 3 days of life of the neonate, it is going to be early onset neonatal sepsis. But now, if it is more, if it is less than or equal to 3 days of life, it is early onset neonatal sepsis. But if it is more than 3 days of life, it's going to be late onset neonatal sepsis. Now, why is this classification important? The classification is going to be important in order for us to visualize the pathogenesis of the neonatal sepsis, which I'm going to do in the next video. So we have started up with the classification of the neonatal sepsis. As you have seen, you see early onset and late onset neonatal sepsis. So those are the different elements that you have to visualize when you want to start up with the patient that has neonatal sepsis. So those are the first point on the introduction of neonatal sepsis. We have the definition, and then we have the classification. In the next video, we're going to visualize the pathogenesis.